I'm Aitana. I'm here from DailyClout. I'm here with Dr. Thomas Levy, MD. He's a cardiologist who's been working with the U.S. Freedom Flyers and has recently had some sort of paper that he'd like to discuss and share with us. Thank you for being with us, Dr. Levy.
My pleasure, Aitana.
So can you tell us a little bit about yourself and what led you to the Freedom Flyers, and then a little bit about maybe just a quick summary of what the paper is about?
Well, no, a friend of mine brought me together with the Freedom Flyers because they have concerns over what's going on with the FAA with regard to the regulations on vaccinations, and even more importantly, perhaps, the regulations or the lack of regulations involved in clearing people for heart status to fly. And this has become a major concern because as a clinical cardiologist for many years, long before the pandemic, I really never saw myocarditis. To be accurate, I saw it once. And I worked in large communities, had a lot of referrals. And so I had a high number of patients coming through my office. So at that time, it was just a condition where the wrong virus caught you at the wrong time, inflamed and enlarged your heart, and you either went into heart failure and died, or just stayed in heart failure for the rest of your life, or your immune system kicked in and gradually knocked out the virus, the inflammation went down, and the heart size came back to normal, and you survived. Well, now we have a brand new entity since the pandemic started, and that's the COVID spike protein and or spike protein from vaccine-induced myocarditis. The spike protein is part of the COVID virus that penetrates the cells so that the virus can replicate. Unfortunately, as it turns out, without going into a lot of needless detail, it turns out that long haul or chronic COVID, along with a number of individuals who have just received vaccines and nothing else, have a persistence of the spike protein inside their body, such that it actually seems to be that the spike protein, which is toxic, it's defines as a toxin, manages to effectively replicate or reproduce itself, which is the last thing you want a nasty toxin to do. So anyway, there appears now, and we don't have the precise number, but there are a substantial number of people who have very low-grade levels of myocarditis. So low, they may feel perfectly fine, okay, and not have anything remotely resembling the whole array of horrible symptoms when you have a large amount of inflammation in your heart going on. And this is detected by a sensitive test called the troponin level. The troponin level is simply a measure of a substance released by the myocardial cells as they die, or sometimes when they're highly inflamed and then later on salvage themselves and manage to stay alive and not completely necrose. The point being is, traditional myocarditis, you need to have a certain level of troponin to be defined as myocarditis. Well, everybody should realize there's no such thing as a normal level, as a normal elevated level of troponin, no matter how minimal the elevation, okay? We combine this with the fact that the spike protein causes inflammation by attaching to receptors on the blood vessels in the heart, and this makes the heart prone, and other organs as well, prone to blood clots. And the way to track this going on is by another test called the D-dimer test, which actually measures whether and how much your body is continuing to break down blood clots that have already formed. So now we have the scenario of, just aside from pilots, if we're talking about the general population right now, of a large number of people, not well defined how many, but substantial, who either post-COVID, post-vaccine, one or the other or both, have a persistent presence of the spike protein in their body and have minimal subclinical elevations of troponin, and many of them also elevations of the D-dimer, although not necessarily so. And so what does this mean? Well, this means when you have any sort of low-grade inflammation of the heart, no matter how minimal, you have cells that are electrically unstable, okay? They're inflamed, and if it's the wrong section of the heart, they can precipitate abnormal heartbeats, okay? They're irritated, electrically unstable, and this can be any of a variety of things, from just bothersome extra beats to rapid heart rates to life-threatening rhythms that if you're unable to get resuscitated at the time you have it, will be the cause for sudden death. And I think most people who have been following this and following articles around the world, there is a very large increase in sudden death, especially so amongst young people, young and middle-aged people, okay? And I won't even go into all the rationalizations why they're trying to explain this away, but the fact of the matter is it is occurring. The fact of the matter is there's a sizable number of people with this low-grade inflammation, and they don't know about it. So even before I get on to the pilots, let me just say that it's my recommendation that everybody gets this troponin and D-dimer test. That needs to be in the normal range. And if not, you need to see a integrative health practitioner, because most regular physicians will just ignore you or laugh at you. I won't even go into that either. But these are abnormal tests, and they require specific treatments that are covered in the article that are needed in order to completely wipe out the spike protein and bring the inflammation back into the normal range. Now, with regard to pilots, we have
Can I take 1 second and absorb that a little bit? First of all, I just want to say that that might have been the most simple and comprehensive description of how the spike proteins are affecting the heart that I've heard. So I really appreciate you breaking that down, because that was very easy to follow along as a layperson who is not at all medical or scientific. So I appreciate that. So when you suggest that everybody get these types of tests before we move on to the pilots, do you mean people who have had COVID or the COVID vaccine, or only if you've been vaccinated, do you expect the spike proteins to still be being created?
If you've had COVID or a vaccine, definitely, but I actually recommend it to everybody because, and this is very unsettling, I realize, there's an increasing amount of evidence, not really published yet, but from many different quarters, that show there can be a shedding of the virus, a shedding of the spike protein. So I can't give anybody an assurance that they don't have a low-grade level of the spike protein affecting their heart or other organs in a bad manner until they get these tests, okay? If you've been asymptomatic the whole time, they'll probably be normal. But this also brings up the next point, which is, hey, it seems like something else is coming out every day, right? So even if your tests come back normal, that's fantastic, but it's also great as a baseline if you develop problems in the future. So it can be seen when these tests get repeated, has something new popped up in this area, and then you can be very comfortable as the treating physician or healthcare practitioner that you've got something that's definitely arisen in the context of whatever this new infection or new symptom or new scenario is, and it's got to be aggressively gone after. And the other thing too is most of the body, the other organs, don't have, shall we call them, marker tests. So the idea that you have this inflammation in the heart is really a pretty strong indication that you have the inflammation in other organs throughout your body. It's just that those other organs don't have a unique substance they release as the cells die. So we're tracking the heart, but it's really a good implication of going on everywhere else.
So, okay, so it seems like there's a proliferation of the spike proteins in the general population at this time, to, the extent of which we don't know in different people based on their own personal situation, and that you would recommend people begin to check these dimer and troponin levels in their own, with their own practitioner in order to at least establish a baseline.
And if your practitioner won't order it, find another practitioner. I mean,
Absolutely.
we're talking about people's lives here, and I don't even want to take it aside into what the other doctors do and why they do it, but these are medical tests, and no physician should conscientiously object to somebody wanting to know about a test on them, especially if they're paying for it, right?
Right, of course.
Okay.
And I think, with that being said, we're going to see, and we already are seeing, a major shift in the way people view healthcare, at least people in the medical freedom movement. And hopefully that will result in organizations and healthcare clinics rising up that put medical freedom at the forefront. So let's move on to the pilots and how this all relates to them.
Well, a lot of this, almost all of it, came as a great shock to me, because I was just another member of the naive flying public that just believed everything that needed to be done was being done. So, I'm safe when I get in an airplane. And I'm not saying you're not safe now, but you're not as safe now as you were 3 years ago, I guarantee you.
Understood.
Why is this? Well, what is routinely done to become a pilot, heart-wise, you do a history, the history's fine, and you do an electrocardiogram, and that's it. So if you have a normal electrocardiogram, you've passed the heart exam. Well, the electrocardiogram just shows you haven't had a heart attack in the past. It's got no predictive value at all as to what's going on in the future, insofar as you could have many blockages, but they just haven't blocked off completely and caused a heart attack. What you need for this, and it's my highest recommendation to whoever implements these rules, that all pilots get an exercise stress test. You exercise the heart and you see if changes take place in the EKG, and that gives you direct information as to whether or not you're dealing with somebody at a higher risk of heart attack. Now, what has happened is some other findings on the electrocardiogram. Normally, you have a spot in your atrium called the sinoatrial node. It starts the spark, and that spark generates across the atrium till it hits the AV node, and then the AV node disseminates it to the whole heart so that the heart contracts simultaneously. So you don't have a bunch of cells slowly contracting, but it gets them all out, quick contraction. Well, the part that's in the atrium is called the PR interval. And to make it simple, the PR interval is just a measure tested through time that represents the normal range that this delay should take place. And the number is 0.12 to 0.2 seconds, okay? If it's below 0.12, it's conducting it too fast, and you can have arrhythmia problems. And if it's more than 0.2, it's conducting it too slow, and you can have a whole host of other problems. So that's the normal range. Everybody's fine. Well, when you get above 0.2, it's called a prolonged PR interval. In and of itself, that's not terribly significant, especially in a younger person. Many people have normal levels throughout their life. Lots of younger people have longer PR intervals, but it's part of normal athleticism and other things that take place. However, and this is the kicker, if you've had the normal range all your life, and now it's starting to prolong as you're an adult, that implies a whole host of different things. That implies a whole host of different degenerative changes that are taking place in the conduction system of the heart that can give rise to a whole host of problems. Well, a study done in Harvard in 2007 on many thousands of patients followed over a 20 to 30 year period looked at individuals who had just beyond the 0.2 level and followed them. The tiniest increase in the PR interval meant over time you had 2 times the chance of having atrial fibrillation, 3 times the chance of having an abnormal or slow enough heart rate to need a pacemaker, and 1.5 times the chance of dying from anything, all-cause mortality. So wow. This tiny increase in the PR interval is not innocuous, and obviously in the setting of the pilot population, it's not acceptable at all. Now we get to what's really the horrifying part is the Federal Aviation, the FAA, the Federal Aviation Administration, who's in charge of licensing pilots and clearing them medically. Since the beginning of their existence, they went with a 0.12 to 0.2 PR interval as being normal and not requiring any more evaluation. Now, out of the blue, between 2021 and 2022, they've raised it to 0.3. And let me tell you, 0.3 is a humongous raise. It's a very long prolongation. It's 100% increase, okay? And one might ask, and I don't know this for a fact, but it certainly applies to logic, why would the FAA do this? Obviously, the FAA is seeing huge numbers of PR intervals greater than 0.2, but they don't want to disqualify pilots or even more significantly, even subject them to extensive testing, because it's very obvious to me they'll do anything to avoid reasonable testing. But hey, you know, anything you do in a large number of people costs money. But so all these folks need stress tests. They all need to know, and we need to know, that have normal troponin and normal D-dimer levels. Now, don't get me wrong. Somebody with a 0.3 or higher PR interval can check out fine in every other regard and be perfectly fine to fly, but not without further testing. That's the big bugaboo. Furthermore, going back to that study I just mentioned, all those changes were seen just as you got above 0.2. The next line was longer PR intervals have a substantially higher incidence of all these negative effects. So when you get to 0.22, 0.25, or as high as 0.3, then you're looking at really big changes. And the fact of the matter is, like I said before, the normal electrocardiogram means nothing. It means you haven't had a heart attack and they haven't checked you out any further. So I'm shocked as a physician. I'm frightened as a flyer. And the only thing that gives me comfort right now is the fact that they have two pilots in each plane. Okay.
Well, I saw that they might be looking there. Someone is attempting to remove that requirement.
Well, that would be truly catastrophic.
I've seen numerous headlines that has to be checked.
I've talked to a number of pilots, and they already currently are relating episodes of their friends who don't want to lose their jobs, but you know, they had a moment in the cockpit where they just lost the ability to concentrate or focus, and it's like, you know, and they come out of it 10 seconds later, like lost time.
10 seconds, that's too long.
Oh yeah, there's a lot of times where that 10 seconds is too much time. So the point is things are already happening, and you know, all governmental agencies, you know, they only do something if they're in a position of being embarrassed or blamed. So this needs to get out to enough people so that some demands are made on the FAA, because to me, there's absolutely no explanation or justification for
avoiding
moving the goalpost. Okay, the goalpost was at 0.2 for as long as the EKG has existed. And now the goalpost is 0.1 second further back.
That is really, truly, it's inexplicable. But the longer they push off confronting this issue, the worse it's going to be when they ultimately confront it. If they confronted it now, where, you know, thank God there's been no major, I mean, there's been near misses. There's not been any major, you know, 300 passenger plane or anything like that. If they confronted it now, they have a chance of avoiding that.
And a couple of these pilots, you know, no major events, but already it would have been a major event had there been one pilot in there rather than two, because one pilot has observed the other pilot just space out. And actually, in the words of this one pilot, start doing the exact opposite of the things that he needed to do. And then it's sort of like he had a realization instantly with what he was doing. And rather than try to do anything else, he just pushed himself back in his chair and let the other pilot take over.
Has this type of description of behavior in the cockpit something that you've heard about prior to COVID?
Well, I didn't know any pilots prior to COVID.
Okay,
so yeah.
Fair enough. Fair enough. Okay, can you just describe a little bit about how, your career as a cardiologist and at what point you realized that something was wrong with the broader medical institutions?
Oh, my goodness. Close to 30 years ago now, when I was a cardiologist in Colorado Springs, Colorado, and I had occasion to meet a dentist by the name of Dr. Hal Huggins. We became friends, and he had a dental clinic, and he had patients coming in from around the world, and he said, come by and see what we do sometime. And so I did, and I saw things that modern medicine, of what I was told was modern medicine, could not be explained. They defied what I learned in medical school. And what Dr. Huggins did in his clinic was a total dental revision. They took out infected teeth, root canals, they took out the mercury, they started supplementation, and it was a 2-week program. And I saw lab work that I never saw improve and sometimes even normalize in 2 weeks. Well, one day he had me visiting over there. A little old lady with advanced neurologic disease in a wheelchair came into the operatory to get some dental work. And I jumped in and out, seeing what was going on. And over the course of several hours, this little old lady became more and more and more animated, more alert. And when she finally finished up, she told her caregiver, man, I'm feeling great. Let's go out and have a steak. I'll chew it on the other side of my mouth. I'm ready to have a good meal. And Hal walked into the room, and I looked at him, and I said, Hal, what's going on here? And he pointed to the IV. Well, anyway, we played some word games for a while, and I said, okay, Hal, what's in the IV? And he said, 50 grams of vitamin C. And at that point in time, I mean, it was like a light switch went on. And I said, well, I'm not in the habit personally of denying what I've observed, denying of what I know to be a fact. And things are happening here that shouldn't happen. And at that point in time began my research in vitamin C, and about 13 books later. And not only that, in the course of that, I just stopped my cardiology practice and began a consultative service to Dr. Huggins, which also, interestingly enough, paid me well, so that I really did the crazy thing of then getting a law degree after that, because I had the time and the money, and I also saw how horribly prosecuted and harangued and harassed Dr. Huggins was, such that he had a lawyer on retainer for just practicing dentistry that helped people. And I said, well, I'll probably need a little protection in the future, so I'll get my law degree. So I did that, and then after that, I just worked with some friends, and we had some clinics and did a few things like that, and then spent a lot of time reading and a lot of time writing, and until the pandemic hit, taking lots of trips in the States and around the world, giving lectures. But now the pandemic has brought a lot into focus, okay? And as you mentioned earlier, and it might be one of the best effects of the pandemic, which is people now realize what a fraud modern medicine is. And they also realize that there's a ton of doctors out there that don't care whether they live or die, and don't care about being told or not giving medicines, hydroxychloroquine, ivermectin, being instructed not to give them and not having any problem with it, or denying patients intravenous vitamin C. the most harmless and beneficial substance on the planet on patients in the intensive care unit, they need to go to jail for negligent manslaughter.
I agree with you. And I was actually going to ask you how you are one of those doctors who did manage to see through through the system. And I have my answer. It's because you've been working independently and you've been an independent thinker pretty much from the beginning, partly thanks to Dr. Huggins, but
Absolutely.
also because, that just seems to be the direction you're heading. So that was a fascinating story. I'm really glad that we got to hear that. And I think that pretty much wraps it up for now. Thank you so much for all of your work, your independent work, your work with the Freedom Flyers, and just spreading your knowledge of health to everyone. So thank you.